All right, welcome everyone. We're so glad that you've joined us this evening for this conversation with Dr. Susan Phillip, Acting Health Officer of the City and County of San Francisco, COVID 1 year later. So we're so happy to have Dr. Susan Phillip with us tonight, and we're glad that you've made time to be with us. We expect to be here an hour, maybe a little bit less, depending on how questions are, but what I really want you to do is to be thinking about the questions you want to ask, even if you think maybe that Susan has answered those questions already. Go ahead and ask it anyway, because there's always more nuance and things to flesh out. So, Susan, welcome. We're so glad, I should call you Dr. Phillip, so glad that you are here with us tonight. And I thought we'd begin with just a little bit of brief introduction. Tell us a little bit about yourself, and so that we can get to know you a little bit more as well, because part of what we're doing here is not only learning things, but it's also just a good community building event as well.
Well, thank you. I'm so happy to be here. And can we make a deal? Is it okay if I call you Fred and you call me Susan? I would really
I think that's just fine. I would be totally down for that.
That sounds good. Well, I'm so happy to be here with you. And a little bit about myself. I grew up in Florida, and to be precise, I grew up in Lakeland, Florida. And I know that matters to you, Fred, because that is also your hometown. And I have to tell you, people, this is unusual, because this is not a huge city. This is not Miami. This is not Jacksonville. This is a relatively small town. We were just talking. It was about 70,000 people when I lived there in the 80s. So it's not too big. So when I came all the way across the country, and Paul and I had just been married, and we were checking out churches, I said, this is a sign from God that we need to check out City Church. So we came for Lakeland, but we stayed for the messages and the commitment and the community.
You probably are the only person that visited City Church and said, oh, Lakeland, Florida, this is our place.
Well, Fred, I'll tell you that I had not been going to church for 20 years. So I know you hear that story many, many times, but City Church was a place that I could re-engage and have felt that way ever since.
That's fantastic.
And so we started coming here when shortly after Paul and I were married. He moved down to San Francisco because I was here. I did my schooling and my medical training kind of all over the country. And from Florida, I went to North Carolina, and then I was in St. Louis for medical school, went to Chicago for residency, Boston for a year, and then San Francisco. Wow. Came out here for my infectious disease fellowship training at UCSF. So was living here, and Paul and I had actually been in high school together. So we have this continual connection to Florida because our families live there. Both sets of families, which is convenient for, back in the days when you could travel. We actually could see all the grandparents at once. Then he moved down here. We got married. He moved down here from Tacoma, Washington. And I have been, after fellowship, I started working for the Department of Public Health. So I've worked for them for 16 years now. And I was one of the deputy health officers. My background is in infectious disease, so doing communicable disease, HIV, STDs, general communicable diseases, and have been one of the deputy health officers for about 10 years. And the former health officer, my boss, Tomas Aragon, has gone on to be the state health officer, which is great for us to have his expertise in Sacramento. And I'm the acting health officer now. And health officer is kind of an odd position. It's a sort of mandated position in California. It's a position that has a lot of powers when there are communicable disease issues at hand to do various things. And it's the kind of thing where no one knows what it is until this past year. And then everyone has an opinion about what they are or aren't doing.
Yeah, and then suddenly you're in the spotlight all the time.
That's right. Yeah, there's a big spotlight. But there's a lot of help.
I was talking to Susan right before the broadcast, and she says a normal day is she's working till 8 p.m. So in the past year in particular. So thank you for all that sacrifice that you and so many of our health professionals are making. We have so many doctors and nurses in our congregation I think about Mike Reed, who's at SF General, and Scott Balsitis, and then the myriad numbers of researchers and nurses in our community. We're just really grateful for all of you. So let's take a moment just to say thank you for all the hard work and keeping us safe. We're very grateful.
Yes, very happy to do that. And Mike and I have had a chance to work closely together as part of this.
Great.
And
Yeah.
the city effort, so that's been really nice. And I know there are many, many people that are involved. And Lucia Angel is helping run one of the clinics that does testing and vaccination. So lots of people involved.
Yeah, Lucia's just come on our elder board, so we're very grateful to have her. She's very stretched for time, so we're privileged to have that with her. So anyway, great. And then there is Tommy and Jack, your children. Woo!
Jack, and I think they might be watching. And hey guys, their question's going to be: does this count against their screen time? Well, no, this is a bonus.
There you go, Tommy and Jack. Awesome. I just want to say, Tommy and Jack, I miss you, and I can't wait to fist bump in the back of the Russian Center one day again soon. Not soon enough. And
love that. Yeah.
So you're not only the acting health officer, but you're dealing with what so many other of our congregation are dealing with, which is raising kids, schools, doing schooling from home, all of the stress and trial of that. I just can't imagine how much has been on you and Paul during this time, and for Tommy and Jack as well.
I am so grateful to Paul, because he really, the brunt of this has fallen on him, and he has never once complained. And Tommy and Jack too. I mean, those guys are troopers. They're really troopers. And I was saying the other day that we're treating it a little bit like, a NASA astronaut family. Like they're sort of like letting me sort of go into orbit, and I have a particular set of training and skills that I can use to help the city right now, but I can only do it because of what those guys are doing for me. And so I'm very, very grateful to that. And
Paul just said in the chat that Tommy and Jack fist bumped me back, so it's made my evening. Wonderful. So, here we are, we're 1 year later, and I was, I don't know if anybody else is doing this, and maybe it's just weirdness of Fred Harrell, but as we've eked into late February and then the early March, I've actually looked at my calendar from a year ago, okay, this is where I was having dinner with these people, I was doing this. And on this very day, a year ago, March the 4th, I was in Scottsdale, Arizona for a retreat. And because the Giants are in Scottsdale, I went on this retreat. No, I went for spiritual development. But I remember this day a year ago, I was sitting in the Scottsdale Stadium in Arizona watching the Giants play a spring training baseball game. And we had been talking that afternoon about this new thing, this SARS, COVID-2, 19, all of it. And we were all kind of trying to figure out what this meant for us. And I remember watching the game that day thinking, am I going to see the Giants play again this year? And the answer turned out to be no, except on television. So I guess I think it'd be fun for us to hear, where were you? What impact did it have on you when you first realized that this virus was going to be a huge deal for the U.S. and the world at large?
Well, we started hearing and thinking about this really early on at the health department, and just because we're on the West Coast and we've got colleagues up and down in Seattle and LA, and people were thinking and talking about this. So this was pretty early in January that we started discussing, what was going on and trying to get as much information as we could, which there wasn't very much at that time. Yeah. But we made a decision. Actually, I have been enmeshed in this and thinking about this for longer, actually, than most people. And January 21st of 2020, our Department of Public Health started operating what we call our Department Operations Center. So it's a little bit like an emergency center to kind of respond. I remember we had the big monitor up with that Johns Hopkins global map, and we were looking to see the numbers of cases and where they were coming. And I remember doing an initial press conference in a tiny room with all this media, just trying to answer questions about what was going on. That was on the 24th of January. And it's just snowballed ever since then. But we look back and we were all crowded into conference rooms and talking to each other. And now, of course, we wouldn't never do that. But there was a lot that we learned over that year.
Yeah, I think everybody's thought about things they did in late February, early March, and we're like, holy crap, I'm so glad that could have been bad. Yeah. Wow.
But it hit me. I think one of the biggest things, it started getting very, very busy very quickly. But I remember I stopped at one point and I called my parents in Lakeland, Florida, and I told my dad. My parents are both in medicine also, so they understood what I was saying. And I said, I want you to go and get 3 months worth of prescriptions and do everything that you need to do, because we knew that this virus was worse for people that were older. And and I told him that, and I told Paul, like, call your parents too and tell them the same thing. So it was we knew something was coming. It was just a matter of like how much was it going to be.
So you didn't tell them to go buy as much toilet paper as possible? You didn't tell them that?
I didn't have the foresight. I did not have the foresight to invest in toilet paper stocks or to buy a lot.
Yeah. Well, a lot of people were buying lots of food. I know that we were trying, we didn't know if the supply chain was going to be impacted. There's all these different myriad questions. I almost don't want to revisit it because it's kind of traumatizing to think about those early days. And I imagine that you and Paul, your husband, had to like start thinking about, okay, next 10 months, next 6 months, next year, whatever at the time, we're going to have to, I don't know what the word is. We're going to have to buckle up. We're going to have to get prepared. We're going to have to be ready for what may. Yeah.
I don't think we knew. I mean, if you told us then, or told me then, it was going to be, 13, 14 months of this, and we'd still have a ways to go after that, I think, we would have fainted on the spot. So it's probably good that our knowledge was limited and that we didn't know exactly what it was we were going to have to do. But I think, we didn't even have a direct conversation. We just sort of knew this is what had happened. And people were thanking me, and I said, well, if I'm not going to do this now, what have I been training for? So, and I think a lot of us feel that way. People just step up and do what needs to happen.
Sure. Yeah. You just have to respond and survive. Yeah. Wow. Amazing. Well, I thought it'd be great for everyone to hear tonight from you. Just to maybe we'll start with you just kind of presenting a few facts and figures to kind of like where we are right now. Where are we in the pandemic? Where are we in terms of the pandemic itself, how much it's still impacting our city in particular, and then treatments and vaccines and distribution and all those kinds of things, just whatever comes to mind for you. This is a pretty informal time, but just let you talk a little bit about that. And then also, for those of you listening, if you have questions, no matter, even if, again, go ahead and ask them now. If there's something that you really want to answer tonight, go ahead and send those in to us on the chat. We'll make sure that we collect those. And then after Susan's done talking here a little bit, we'll start going through some of your questions. So you don't have to wait. You can start sending those in right now. So Susan, go ahead. Whatever you would like to say about where we are right now.
Yes, thank you so much. And I did not do slides. I do a lot of these talks, and I usually bring slides, but I wanted this to be more conversational. And I will tell you all that we have a lot of data available. So if you go to the sf.gov website, you'll see a whole COVID-19 section, and you can get all the statistics and the data curves and information. Now we're putting up more information about vaccinations and how we're doing as a city. But I will tell you that San Francisco, as we all remember and know, acted very quickly. So I can remember being in a huddle with a small group of people and trying to decide. We hadn't had a single case. There have been cases in Seattle. There, of course, were a lot of cases in China, but not in San Francisco. And I think we made a good decision. We said we're going to actually declare an emergency. And sort of bring, what that allows us to do is bring all the powers of the city sort of to bear on the issue and try and do a lot in quickly.
And I remember when the mayor called that emergency, it was like in January, wasn't it?
It was, she called the emergency, I think in February 20, early on, but we hadn't had a single case. And there were a lot of people that criticized that, saying,
I remember.
Why would you do that? We haven't had a case. It's not necessary, but it's sort of like standing on the beach and you can see a tsunami coming. And why would you wait for it to hit you before you do that? So we did that early. And we have been one of the most conservative cities in terms of our just thinking about our overall health orders and the limitations that we put on things. And I know that's been very, very difficult for people's lives, their day-to-day lives. But the outcome of that has been, even though we had some of the first cases in the US, we have not had the death rate that many other US cities have had. We have one of the lowest death rates per capita of any city in the United States. And I think that is a really, really important thing. And so the protections that we put into place were able to help the people who are most at risk for getting very, very sick and dying. And in particular, these were older people who were 75 and older and even 65 and older, and particularly people who were in nursing homes, in skilled nursing facilities and long-term care facilities were highly at risk. So very quickly, Dr. Aragon, the health officer at the time, I was the deputy health officer assisting with some of this, put into place things that said, no visitors, and we need to actually try and protect the residents there. And it did work. And we continued to have cases throughout the city. The other thing that was a real struggle back then, and I'm not sure how visible this was to the outside, is testing was a huge struggle. And it felt like whack-a-mole. Like if you addressed one thing, then something else would come up. There was a shortage of the reagents that were needed, or there was a shortage of the test kits, and we didn't have enough of the machines. And it was really just trying to source all of this. And unfortunately, there wasn't the kind of federal coordination that you need in a pandemic. And that was a huge thing, because then all of the local and state governments are trying to figure it out on their own. And that is not, what you want to do. There's a whole playbook for how you deal with a pandemic. And people have been preparing for this for decades. And we knew that this was a possibility, but they didn't have the will or the thought to actually allow that to happen, to take control and do what needed to be done. You can't sort things like this at a local level and have it be successful. So, there was a lot of those kinds of things that happened. But so San Francisco has been able to keep their testing levels very high. Again, one of the highest in the country. The case rates relatively low, and really now our effort is around vaccine and how do we get vaccines out and to people. So it's been a lot. I know people have been through a lot. People are tired, and they're tired of the restrictions, and they're tired of the health orders. And they have the infections have come and gone in waves. So we have had different surges. There was a small one in April, and then there was another one in July. And then we had this very large one that I think people remember that happened right after the holidays, December and January. And now things are coming down. Our case rates are coming down. We're averaging about 7 cases per 100,000, and we were up at 40. At one point in the winter, and so things are looking better, and we are also, as a result, opening up and allowing more things to happen. And I've been involved in writing those orders and authorizing that to happen. And so we'll have to see, because the pattern is, as we loosen, as people come together, then the case rates go up again. So we're going to have to see, what that pattern is. But I think one of the key messages that I want to convey is, we do have the ability to decrease those case rate increases, and to limit how much spread there is if we keep doing the things that now people know they could say in their sleep if they're woken up, is wearing a mask and staying 6 feet apart, and washing our hands. All those things are so important.
Yeah, I see the sanitizer right behind you on your desk.
My huge nice bottle
placement. Well, so I just wanted to ask one quick question about that. I know that in between the disease onslaught and we're all, including scientists, still figuring out this virus and how it responds and how it reacts. What was the state of treatments going on in this time, and has that helped get us to where we are today with a lower rate? Or has it just all been the city of San Francisco just doing a good job on behavior and wearing the mask and distancing and so on?
Well, I think the treatments have really improved. Over time, there really wasn't a lot to begin with that people had found to be effective. And again, because this is a brand new virus, nobody had immunity to it. It really could just spread throughout the population. And it's a respiratory virus, so it's as we know, it's spread by talking and singing and being in proximity to each other. So once people get infected, then the treatments come into play. It's better if people are not getting infected in the first place, but the treatments have enabled people to recover and not die from the virus, and so important to do that. And our hospitals had the ability to administer those medications as they were studied, as they were evaluated and shown to be effective. And so we've heard about some of these. Remdesivir is one of the drugs that we've heard about. Steroids are also things that are effective against the virus. And then for a while, it was very much just supportive care until these treatments came about. That you just would try to put people on the ventilator and support them, do the work of breathing for them, and hope that their own system could recover. And that didn't work when people had other illnesses underlying, or if their disease was quite severe. So it's a very challenging it's a challenging infection to deal with, and so that's why prevention is really the mainstay in trying to prevent people from getting infected in the first place. So
in the first place, right?
So our measures that we've been using this whole time, and now really our ticket out of this pandemic, is going to be vaccine. And the vaccine, to me, is nothing short of a miracle, because it was not guaranteed. It was not a slam dunk that we would be here right now with 3 highly effective vaccines that we now have available to use in the U.S. There are so many other illnesses for which we would love to have a vaccine, and we don't. So the fact that science was able to come together and not skip any steps. So I know sometimes people are worried it happened too fast, and there's some mistrust about it. But they followed all of the same regulatory steps. What they did is they compressed them and they overlapped them. So they took some risk, and they said, we're going to start getting our manufacturing ramped up even before we do the final clinical trial. We're going to have it all ready. And it's been amazing, to see. And now it comes from science over to public health. And our job is to try to make sure that it gets to people equitably, and that it does its job of saving lives.
And those were financial risks, right? Because people were having to manufacture and produce without knowing whether these things would be approved.
Huge. I mean, and there's a lot of federal investment in doing this, like to sort of say, look, we're going to make sure that there's some backstop against your loss.
Nice. Okay.
But we need you to be able to do this. And so we're seeing this unprecedented collaboration in a lot of ways. It was just announced, the president just announced that Pfizer and Merck are working together. In no normal world would they ever do that. So it's nice to see. It's nice to see in some ways how we can think differently and get things done as a country when we want to, and when we have leadership that is encouraging that to happen.
Yeah, that's great. Talk a little bit about these vaccines, if you would.
Yeah, the vaccines are great. They are really, again, going to be our ticket out. And there are 3 vaccines right now. The most recent one that people have heard about is Johnson & Johnson. The first 2 are the Pfizer and the Moderna. And those 2 are kind of a novel. They have a novel way of being created, and they're a novel system called an mRNA, or a messenger RNA vaccine. Mm-hmm. And none of these have any effect of like actually going into your cell and staying there permanently. They don't do any of that. But what they do is they deliver a message that then gets created into a protein that is the spike protein of the coronavirus. If you see that picture, those little red pokey things that's at the bottom there, that is what helps it attach to our cells and get inside our body. So our antibodies can get formed when we create this protein through the vaccine. It's not enough of a, it doesn't create the whole coronavirus, so it can't infect us, but it kind of shows the body, shows the immune system, the part that is the business end of the virus in a sense. And so what the body does, the immune system then says, okay, well, this is not me. It knows what's Susan and what's not Susan. And it says, hey, that is not Susan. It shouldn't be here. And it creates antibodies that are tailored, that are custom for that protein. And so it's retained. And then the next time I see it for real, if I'm exposed to it, those antibodies will actually remember and will actually try. They're called neutralizing antibodies. They will go and sort of really try and take out of action that virus. And there's a second part of immunity too, which is T cell immunity. It works in a slightly different way, but both of those things together have a robust ability to protect us from viruses. And so you're teaching the body without putting it in danger to recognize and expel the virus when it comes in. So it is really cool. If you're a micro nerd or a immunology nerd, it's really cool to read about how this was done.
I'm a theology nerd, and I just find it entirely fascinating that our bodies can actually create armies within us to fight off something that is not us. It just blows my mind.
Yes.
And is it true? So I've heard that, like, I have some friends who've across the country who've gotten their first dose, and then their second dose, they've felt a little bit of a reaction, but I've heard them saying, and I've read this elsewhere, that that's actually a really good response, because that means you've got what's called a take.
That can be true.
Yeah.
That can be true, and those that especially is true of the mRNA vaccine. So the Moderna and the Pfizer after you get the second dose. I do want to say that if you get 2 doses and you don't feel like that, doesn't mean that it didn't work and you need to worry about that. Yeah. Not everybody has that, but that can be true because with the first dose, you are initially introducing this concept, this protein will eventually be formed and do that. But the second time, you're doing it, that's really to enhance that response. But you've got some of the antibodies and some of the T cells from the first time, and then they respond. And so that's what you're feeling potentially the second time.
Yeah, I don't want to alarm anyone. Most of my friends basically report they felt little to nothing on both shots. But a couple of times I've seen a few friends go, that second one, it kind of gave me 1 day or 2 of trouble, but that's okay. That means my body's recognizing it well. And then the Johnson, go ahead. I'm sorry.
I was just going to say that it's usually body aches and maybe a little fever. You feel a little bit like you have the flu, but it goes away, and it's not a long-term thing.
Yeah. And then the Johnson & Johnson one is a 1 dose. And there's been a little bit of not controversy, but concern about it because, when it was tested and so on, it was a different time frame. It was a different amount of virus in the atmosphere or whatever. I mean, talk to us a little bit about the J&J one, and do you feel great about all 3 of these? So I know you do the first 2.
Yeah, I'll start by saying I do feel great about all of these vaccines. And the first 2 are reported to have an efficacy of 94-95% against symptomatic disease. So that's really, really important. And people have said for the Johnson & Johnson, which is a different type of vaccine. It's called an adenovirus vector vaccine, which means it's kind of an inert, weakened virus that can take the same concept of having your body create a protein, but it comes in through a different way. Okay. And people have talked about this Johnson & Johnson, saying in the United States it's only 72% effective, and you really can't compare apples to oranges that way. And there's a couple of reasons why. First of all, I'll start with the bottom line. The most important thing to me in all of these trials, it's really outstanding. After people had received their full vaccination series and had a couple of weeks to build up that response we were just talking about, 0 people who received the actual vaccine died. And that is outstanding. I mean, this is like over 100,000 people. And during the trials themselves, nobody died who received vaccine. And it's really remarkable. And we know that the results in real life, when it starts getting used everywhere, is not going to be that good. But to have that in a trial of that size with 3 different vaccines is pretty amazing and almost perfect in preventing hospitalizations. So, those are some of the things that we care most about. We don't want people to die, and we don't want our hospitals to get overwhelmed, because when that happens, the way that we saw in New York and in Italy before that, that is when people die, because they can no longer get a full standard of care. You don't have enough doctors or nurses or staff or beds or ventilators. That's when people are not able to recover. So we desperately want to stop that. All 3 of these vaccines prevent the most severe outcomes of COVID. And so that's a very good thing. The other thing about the Johnson & Johnson, you talked about different eras, Fred. I think that's really important. People have heard a lot about the fact that we now have these variants. We have different types of coronavirus that's around us. And the reason those exist is all viruses do normal mutations. That's just part of what they do. They replicate, they make copies of themselves. That's their whole function to exist. And as they do that, sometimes they just randomly make mistakes. So there's like slight differences that come into the viruses themselves. Many of them they just go away. They don't do anything. But occasionally there is a group of mutations or a mutation that arises that allows it to spread faster or make people more sick. And those are what we call the variants. When the Moderna and the Pfizer vaccines were tested, there were not as many of these variants that we've heard about. We've heard about the UK variant. We've heard about the South Africa variant and a Brazil variant. And there's also a West Coast variant here in California. And, some of those spread more easily person to person. And there's some data that some of them can also make people a little sicker than others. The Johnson & Johnson was tested internationally in Latin America, in South Africa, as well as in the United States. So it was sort of having to perform in areas where these variants are the vast majority of some of the viruses. So it's robust against what we've seen the viruses can do and evolve over time with these variants. And we think, we know that these are good vaccines. So I agree with Dr. Fauci and others when they say like all 3 vaccines are good. And when one is offered to you, the one that you can get earliest is the one that you should take. And by all of us doing that, that's what's going to get us back to more normalcy and being able to do all the things that we miss.
Yeah. I know there's been talk about, and we'll get to your questions next, everyone. I know there's been talk about the supply being low right now. So I guess the question is, why is that? And then what do you envision it being here pretty soon?
Supply is low. That is our number one problem right now, and that's true. That's true all over the country. And what we have done in San Francisco is we've taken an approach of saying we're going to take our time and we're going to try to build a robust network of places where people can get vaccinated. It's sort of the approach of, if you build it, it will come eventually, the vaccine.
Yeah. And
what we've tried to do is say there's not one size will not fit all. So we have these very large mass vaccination sites. And, I'll take a step back and say something I should have said at the beginning is one of the things that coronavirus and COVID has shown us in San Francisco is the impacts of inequity in health and the disparities and what that means for health, what that just means for us as humans. And COVID doesn't cause these things, but it exposes them. It reveals it. And this is the underlying reasons for this are racism, poverty as a result of that, crowded housing, people who cannot afford to stay home and do their work over screen like I'm able to do some of the time. All of those things mean that people are at higher risk. And or they would be at higher risk of becoming very sick if they did get infected. We are trying to make sure that vaccine is accessible to the populations that are at highest risk. In San Francisco, is very clear that that's in the southern and the eastern neighborhoods. And our neighbors who are Latino, who are Black African American, who are Asian Pacific Islander, all are at higher risk compared to their peers for infection. So we're setting up these large sites to be accessible in these neighborhoods, but we also know that people will potentially go to their pharmacies. These national pharmacies are getting vaccine from the government as well, from the federal government. And these large, the state's calling them multi-county entities, but they're the large health systems. So UCSF and Kaiser and Dignity and Sutter are also receiving vaccine. So the city itself only receives about a third of the vaccine, but we help coordinate all these entities. And it's been really remarkable. This, again, is another example of something that's unprecedented. We have collaborated so that different organizations are operating these different sites. And it doesn't matter what your insurance is. You could, so for instance, Kaiser Permanente is helping run the Moscone Center, one of the really big sites there. And you don't have to be Kaiser to go and get a vaccine there. We've set it up with them, so it's pretty agnostic as to what your insurance is. And even if you don't have insurance, you can go to any of these. So we want to build it that way so there's fewer barriers. And as vaccine comes in, we're doing about 6,000 vaccines a day right now in San Francisco. Our goal is to do 10,000 plus. So we just need the supply to come in and be accessible. What the health department is doing, the health systems are really great at doing a very large throughput. The pharmacies and the doctor's offices are good at doing what they do as well, the clinical care there. As a health department, what we're trying to do is figure out ways to do mobile vaccination, pop-up community centers, other ways of getting vaccine into the neighborhood census tracts areas that may otherwise have difficulty accessing vaccine. So we're focusing on the equity component and letting our other partners really do what they do best, which is getting the clinical system high throughput to happen.
That's great. All right, let's get to some questions. We have about 9, so that just gives you an idea of maybe your time frame on each answer, just because we have a few to get through here. It's fantastic. First question, how long do you think that people who are fully vaccinated will have to wear a mask? And how much risk is there for people who are fully vaccinated to get sick?
Well, the good news is on the second part of the question, people who are fully vaccinated are unlikely to get very sick for the reasons that we said. You're not going to be sick enough to have to go to the hospital. You're almost certainly not going to die of COVID. So that is a huge thing. That is a huge relief. People can still get, potentially could get infected, but we think that that's less likely. The masking is going to have to continue for a while because we're in this gradient where not enough people are vaccinated. And we want to, first of all, have a social norm that we're all still wearing our masks because we don't know who's vaccinated and who's not. And then, it's a very small chance, but there is a possibility that even having gotten a vaccine, I might be able to get infected and then pass it unwittingly to someone who is not vaccinated or is at higher risk. So for those reasons, we're going to keep the masks for a little while, but what we will be able to do is potentially keep opening the activities and the sectors we can engage in.
Great, thank you. What advice would you give about 5 guys from my CG meeting in a backyard, outdoors, mass distance, drinks and snacks involved?
So outdoors is always better than indoors, and we think about things in terms of a lot of parameters, right? So outdoors is safer than indoors, and if you can keep your mask on, that's safer than taking your mask off. And again, we're thinking about what's the risk for transmitting. And if you can keep 6 feet away, that's better than if you're close. If it's a smaller group of 5, it's better than a group of 100. So, for a lot of these things, people will need to, make decisions, especially as they get vaccinated. Our health orders actually say that it's better to limit to be smaller, and so right now in San Francisco, what we say is that without eating or drinking, it's a group of 12. And if you are eating or drinking, it's a group of 6. And we're saying, it's a maximum of 3 households to do that. And it's the same thing with restaurants and dining. And so we're not being arbitrary with that. We're just trying to try to keep it to a smaller number so we don't have as much spread throughout the city.
Great, thank you. This is from, oh, wait a second. Wait, how long do you anticipate that family will continue to not be allowed to be with those who are dying in the hospitals?
This is such an important question, and it's the hospitals, but it is also the nursing homes and the skilled nursing facility. We know that isolation is so difficult, and it is itself a health problem for people. So we're working right now to help revise our guidance, particularly around the nursing facilities. One of the first places that we made sure to emphasize vaccination and try and get vaccine to people in San Francisco. And this is true throughout the Bay Area as well. All of us work together and are always speaking about these things. Is in the skilled nursing facilities. And for the hospitals, the hospitals are also evaluating their protocols. Not everyone there is vaccinated yet. Our goal is going to be that by the time people are discharged, they should, many of them, if they meet the criteria, should be vaccinated. Right now, we're vaccinating people that are over 65. We're vaccinating people who are emergency workers. We're vaccinating teachers and childcare providers. And we're vaccinating food and agriculture workers, including everyone that works in a restaurant. So we have to follow the state's system for how we vaccinate. We can't just sort of open it up to everyone. And certainly in this time where there's not enough vaccine, we have to do that. So we're constantly looking at that. And we know that hospital visitation is so important. The stories are tragic of people that passed away and their families couldn't be with them. So it is something we're continuing to look at.
Great. This is from Wanjin, who says, thank you, Susan. As my dad has gotten and has recovered from COVID recently, what would you recommend that he do or not do to avoid as many long-term health complications?
First of all, hi, Wanjin, and I'm glad your dad has recovered. That's great. That's great to hear. So there are, as Wanjin is alluding to, some concerns and some evidence of long-term complications for some people who have COVID. And we don't know if there's anything in particular that people can do or should do in order to minimize that. But I think I think sort of general like self-care and sleeping and nutrition and all those things can't hurt. But we don't have any clear evidence that there's anything that can be done to prevent that from occurring.
Mm-hmm. Okay, thank you. Yes, we miss you too, Wanjin. What is your recommendation for pregnant women as far as vaccinations?
Yeah, this is an area where there also are not good data yet. The studies did not really evaluate this, so we don't have data. What we do know is that it's, again, talking with your doctor, and it's a risk benefit. We do know that the risk of having COVID is real in pregnancy and also can cause serious problems if someone becomes infected. So it does end up being a conversation of the risk benefits in your particular situation, or a person's particular situation, with their provider, with their OBGYN and with their provider. In many cases, it does make sense. So, for instance, a health worker who is pregnant, we almost certainly would advise that they get the vaccine, right? Because they are treating people potentially, or being exposed to people with COVID. They are among the highest risk, and there the risk benefit would lean in the direction of getting the vaccine. And so there are studies that are going to occur with pregnant women. So we'll have more data on that in the coming months. But in the meantime, it does end up being, a conversation with your provider who knows your own health situation and can advise you accordingly.
Great. Here's a good one. So this person says, I work in education and I'm technically eligible to get the shot. However, I don't teach in person. I'm not at risk. Knowing there's a supply shortage, should I get the shot now or later? What are your thoughts as a person of faith and science on how we can better support equitable, probably two questions here, equitable vaccine distribution in instances like this?
Thank you for the thoughtfulness of that question. And one of the things that I would say is that when you are eligible for vaccine, it's not a bad thing to get vaccine, and particularly to get it from what I was saying might be some of the routes that are a little more difficult for people. So getting it through a commercial pharmacy, get it through one of the high throughput mass vaccination sites. Those sorts of things are there for us, for the general population. But what's difficult is sometimes we might have people traveling in to come to a little community site that's really meant for community. Those kinds of things get more difficult. But certainly, going to the big sites, the ones we have are at Moscone, at City College, and we're going to be having one at the market in Bayview. So it's City College and Bayview. The market used to be called the Produce Market, and at Moscone. Any of those sites are available. So I would say if you are eligible and can get an appointment, go ahead and do that, because our goal is to get a vaccine to every San Franciscan who wants one as soon as possible. The president is saying, by the end of May, everyone will have access, and so we need to get our city vaccinated up. And I think if it's your turn, it's actually contributing to the overall common good to get your vaccine.
Yeah, one more person vaccinated is a win.
It's a good thing.
So do it, right?
Don't feel that you're taking it from anyone. It's your turn, and that's a good thing.
We have a follow-up to the community group in the backyard question.
Okay.
And the follow-up is, what if the 5 guys at the backyard CG meetup are from 5 different households?
That gets trickier. So I won't answer, I guess, in my official health officer hat, which is when I would have to say that's against the health order. And that those things are those are legally constrained, and those are the things that we should know. I think the best thing is if people are just constantly thinking about what is a safer option. So maybe then if that's a situation, you say, what, we won't do the eating and drinking together because that increases the risk a little bit. So it's all on a spectrum. And right. I think we're going to get there. We're closer to getting to being able to be together and eat and drink and do all those things than we were, 6 months ago, or even, 3 months ago. But we're not quite there yet. But our cases are coming down. That's all good news. We're moving from what was the purple tier, which is kind of in the state system, the most restrictive, where we've just moved to red. And, we're continuing to come down. So we are going to allow more, there's going to be more gathering allowed very, very shortly.
So it really is about, in some ways, juggling those different factors, Yeah.
And no gatherings indoors, please. That is really a sure way to spread it. So be with others, and we're fortunate in California that we have somewhat of a mild climate. If you can be outdoors, that is really the way to do it.
Yeah, there's an old expression that comes to mind that one of the formative people in my life early on, he used to say, Fred, just because you can do something doesn't mean you should do something. And I think that it's interesting because, you have both the local orders of our city and the governor, but then you have the Supreme Court ruling that the governor can't do what he said he wanted to do. And so we have permission to do things, but I remember that passage in the Bible, all things may be permissible but not beneficial. And gathering indoors may be one of those, yeah.
And I'm glad that you mentioned that. I think one of the challenging things for me is just watching some of the conversation, both on my Facebook feed and just nationally, of churches and Christians, and just what they're focused on about this is really what they feel that they're entitled to do and that they have a right to do. And I think, the Supreme Court has said that's right. You do have a right to worship. But I think, Fred, to your point, I often think that too. Just because we can do something doesn't mean we should, or that it's the right thing to do for our fellow citizens. So I personally have to thank you and thank the staff, the elders, and the members of the congregation, my fellow members, because I haven't had a chance to talk to you much at all, like right up until recently. And I never had to worry about what City Church was doing, because I knew that you were intent on trying to follow the guidelines and the orders, not because it was the law, but because that was loving your neighbor. And
the way of loving neighbor, yeah.
I am so grateful for that. I got emotional thinking about it, because it really was putting that into action. So I'm grateful to you all for that. And I know everyone wants to get back together. We're going to try to do it as soon as we can. But,
dying to, yeah. Well, that was another question that just came up. So it is a little bit of a future question. So when do you see churches gathering safely? When do you expect live singing in particular? That's a biggie to happen again. Either a concert, one or a few people singing, or a worship service where it's more corporate.
Well, I think singing is one of the things that is a real challenge. And, we saw that early on in Washington State, where there were members of a choir who were practicing together and became, some people died as a result of that. So we know that singing actually amplifies the release of the aerosols and the droplets that can then infect other people. But as our case rates come down, as we get more people vaccinated, we will, continue to reevaluate when it would be safe to do that. We know that there are lots of congregations, lots of groups that would like to get back to singing. And again, I think we're going to see this phased in. It might be a smaller number. People may have to be spaced a little bit further apart. Everyone else might have to keep masks on. So I don't think it's going to be very quick that we get to congregational singing altogether again, but it's going to be a stepwise approach. And my whole goal as acting health officer is I don't want us to rush forward and then have to move back. I think that's devastating economically and psychologically. So we want to just keep progressing forward back towards life as we want it to be.
Great. Here's a question about travel. Can I travel domestically and visit friends who are also vaccinated once I get the vaccine? What precautions should we take?
It's a good question as well. So once you're vaccinated, it does take a couple of weeks for the vaccine, for the antibodies to sort of fully come up to levels that are protective, and we know that is true. As a public health person, I'm still telling people that they should try and postpone non-essential travel. And, you have to decide for yourself what is essential and non-essential. Like if you have elderly relatives, or you need to see someone or do something, you would determine that for yourself. But we're asking people to hold off a little bit longer on leisure travel, on recreational types of travel, and not necessarily because it's a risk to you yourself if you're fully vaccinated, but again, we're trying to just have people limit the amount of interaction, the amount of travel, and just be cautious about that for now. But again, I think that's going to change. And if you said, what was the absolute risk to yourself of doing that, I think it would be quite low. So it would be more about generally on a community level, is there a way to postpone that for a little while? That would probably be a better thing, but it probably is not dangerous to your health to go on a trip.
Okay. Once we get the shot, what shouldn't we do? How do we prepare for the after pandemic times while still being smart and safe?
Yeah, that's such a great question. And I think it's thinking about it the right way. And I think, again, it's not an on-off switch. And it is going to be more of thinking about, okay, I've gotten vaccinated. So the main thing that should do is make you feel more comfortable doing the things that are already kind of allowed under the health order, right? So outdoor dining is open, even indoor dining is open at 25%. You can feel comfortable that you're safe in participating in those things once you're vaccinated. So that should give you some peace of mind. And then for other things, I think it's, again, thinking along this gradient. And as we adjust the health orders, as our case rates go down, we revise things based on hitting certain benchmarks and open things up. So you will see that change happening over time. And then I think it's also, thinking along this gradient of not just for myself and my own health, but for that unvaccinated neighbor or the other people in the city, and then trying as much as we can to continue to set an example. Continuing to wear our mask even after we know that we're protected from vaccine. It's good to have that norm. And I'm so grateful when I walk around San Francisco and I see that mask wearing is the norm here. I know that's not true everywhere, but that is, again, an important thing to continue for the time being. There are some people who can't or won't get vaccine for multiple reasons. And we want to make sure that we're continuing that culture and that practice of protecting everyone. It will change. We won't be wearing masks forever, but for the time being, we want to continue those things.
Yeah, great. Someone who's asked about they volunteered actually twice. They're saying at the City College vaccination site,
Great.
and both times they wondered, where is everyone? And so they're asking, is it low turnout due to more limited supply or a lack of getting the word out, or is it a combination perhaps?
Yes, I will tell you that a lot of it is supply. So this gets into, saying build it and they will come. I mean, we spent a lot of time building infrastructure as a city that we know is kind of laying idle a little bit, but that's because we didn't want to be in a situation where suddenly we hear from the state or from the federal government, here is your 10 or 12,000 doses a day, go for it. And we don't have an ability to do it. So we kind of have built the machinery, and as vaccine comes in, it will ratchet up. And we also want people, to get the word out. So for anyone who's listening, if you know anyone who's 65 and older, especially because they are at highest risk for kind of poor outcomes and they haven't gotten vaccinated, please go to the SF.gov website. Anyone can go there and find out when it's their turn, and you'll get notified, but then you have to go through another step of registering. But if you can let people know that, if you can assist them in doing that, those are all good things. We want everyone to know that they can get vaccine when it's their turn.
Great. Okay, a couple more questions. People talk about vaccine-based admission to things like concerts, traveling. Is this something you foresee happening in the city?
We talk about a lot of things. So we're talking about this, and we're looking at other places that have done this. Israel does this, quite.
I saw that.
They do a lot of it. And one thing, like a couple of things. One is that we can't do this, or we should not do this, or think about doing this until everyone has the ability to have vaccine. So it's just not fair, right? If someone can do something and the other person hasn't even had a shot at getting vaccine. And then the second thing is we don't really want to create the haves and have-nots to that extent. We have to do that very thoughtfully. At some point, private entities, like if you want to go to a Warriors game, they're well within their rights to say, we want to see that you've been vaccinated. But what we do as a city, I think we have to be very thoughtful about that, and we don't want anyone left behind, and we want to make sure that we've given everyone, a shot to get vaccine. But I think those conversations, will continue to come around, and it likely is going to be more in tailored situations than it is going to be some type of a vaccine passport or access pass that we have on our mobile phones. We'll have to figure out how we do that.
Are you optimistic about Giants baseball in the stadium this summer at some point?
As a public official, I'm kind of quaking in my boots about that. I think it's sooner than I'm ready to have thousands of people coming together.
I imagine
we're gonna have to figure it out. We'll figure it out as a city. I think we've done that, the whole time. We were as everyone remembers, the first region to completely shut down and shelter in place, and everyone thought we were nuts. But we're not going to do that again. Gladly, everyone's happy about that. But we are going to keep figuring things out and moving forward. And it takes a lot of not just government input, but business partners and particularly community members, the most impacted communities. We have a lot of meetings and discussion. And there's a lot of times where I have to, listen to how much people are angry at us and want us to do different. And they have a lot of knowledge that we don't have in government. And so, I want to avoid the biggest pitfalls of government, which is sometimes just being inaccessible, just being a big bureaucracy. We have some knowledge and some abilities, and we need to marry that to thinking about the city as a whole and all of its people.
Yeah. Okay, we're going to end on one that's a little bit forward thinking. I was going to end on one just like this anyway, but it has to do with hope right now. I know we have great hope in the vaccines. They are a complete miracle. I've read enough and listened enough to Dr. Fauci and others to be thoroughly convinced that it's an absolute miracle we have them. And God, thank you so much, because we really would be looking at this up and down for another however long, so that's something to be really hopeful and thankful about. But as you think about the coming 6 months or so, let's say the rest of 2021, what's your vision for that? How do you see it kind of playing out? I know there was an Atlantic article recently that was talking about spring will be about the same as last year, summer, a lot of hope, fall, maybe a little bit of regression. 2022, we're going to be good. What are your thoughts on as you look for the next 6 to 8, 10 months?
I do feel hopeful. I feel hopeful that we have a real shift in how leaders at different levels of government, our federal government, are thinking about this and taking it seriously and investing time. I think that people have an understanding of public health that they didn't before, whether they wanted to or not. This really has made people understand, and public health has been really sorely underfunded and under-resourced. We want smart people going into public health. We want to make sure that we have the ability to do things like contact tracing. It's not just for COVID, we do it for other things. So I'm hopeful about a renewed commitment to thinking about equity, to looking at all these things that have been laid bare by COVID in our society, and not just COVID, so many things, right, happened this year with our important racial reckoning and conversations, and the things they're intertwined, right? We were just talking about how COVID exploits racism, exploits the inequities that exist in our society. So I'm very hopeful that we will continue the conversation and continue the good work. And just on a local level and a health level, I am hopeful that we will continue making progress forward back towards this. I'm very, very hopeful that we will figure out how to get kids back in school. I mean, that is like priority number one right now in the city. We must do that. And we've got to get back worshiping together. We've got to do all those things, and we will get there. So I do see a positive trajectory of continuing, to do that over time. And I've just been heartened by how willing, hearing about people that are volunteering at the vaccine site, just the person that wrote in, and seeing how City Church has really just stepped up and not only refused to put other people's health at risk just because we want to be together, but also has stepped up in so many ways to actively help others and try to step in. So I'm heartened by just the people around. I am very, very hopeful that we have better days ahead of us.
I'll take this second just to brag on the staff. I cannot brag on them enough, honestly. The amount of creativity, whether it's the creativity of making everything go online. I mean, I look at what Newbegin House of Studies has done, and they have created a fellows program that had 135 people in it this year because they pivoted so well. Or whether it's the courage of Paul Trudeau and Sally Steele and all the good folks at City Hope who are feeding people and had to pivot to outdoor. I mean, I look at our staff and the different things that our folks are doing, and I'm just overwhelmed with gratitude and gratefulness to work alongside them. So I'll just agree with you on that one. Well, okay, so the website, real quick, let's repeat that. If you want to go on, you want to learn everything you want to know about this, and you want to make sure that you get signed up so you get texted when you're available to go sign up for an appointment to get vaccine. What is that again?
So it is sf.gov, sf.gov. So if you go there on the first page, you'll see COVID-19. You can click on it, and it will. You can go down a rabbit hole of all the data, all the vaccine information. Everything is right there.
Yeah. Yes, and I see that, Thomas Lee, Jason Morrell. Absolutely. Shout out once again to Jason for the work he's doing right now behind the scenes to make this work.
Yes,
okay, so that's great. Susan, thank you so much for being with us. I'm grateful that we can end quasi on time. It's 8:06. I know that your time is incredibly valuable and stretched. And for you to give us this is just really a tremendous gift. And we're just very, very grateful and inspired. And we are all praying for you. And as you continue to go through this, hopefully once in a lifetime event. It's interesting when I talk to you and I talk to Scott Balsidis and others are like, well, on one hand, this is what we've kind of trained for our whole lives. But at the same time, we want it to go away as soon as we can. So we appreciate so much keeping us all safe.
Yes, thank you so much. I appreciate the well wishes and the prayers. It means a lot and it makes a difference. So thank you.
Yeah,
You're welcome. Thank you, Fred.
Thank you. All right, friends. So that's going to wrap us up for tonight. We'll just go ahead and tell you that, of course, most of you already know, but we meet here on all of our live platforms: Facebook, YouTube, Twitter, and Twitch every Sunday morning at 10 a.m. We'll have a special guest preacher this Sunday, and you can read all about that in just a moment as you see it coming up in the kind of the after show credits. But we're grateful that you've joined us tonight. We wish all of you a safe and good evening as we continue together to hang in there, to see what God will do through us in the midst of this trial and then through it on the other side. So thanks so much for joining us. Good night, and go in God's peace.
Thank you.